everyone. Happy Tuesday. It's Shannon from the Lantern of Madison, and thank you so much for tuning in for Shannon's Sunshine Share today. So I have been with the Lantern about 6 years. I am a licensed practical nurse, soon to be celebrating my 17th anniversary as a nurse. I also assist the Lantern with marketing and the admissions process for folks who are moving in. And I do provide a lot of community education about different health topics for the organization. So I absolutely love what I do. It's lots of fun. And I'm excited that you're here with me today. So today I want to talk a little bit about diabetes and just kind of give a general overview of diabetes, some of the things we can do to prevent the disease, some of the ways that the disease is treated, and things of that nature. So diabetes is a disease that affects the way that our body uses food. So most of the food we eat changes over to glucose or sugar, and our body uses that as energy. So in someone that has diabetes, the pancreas, it's an organ near the stomach, makes a hormone called insulin, which helps the sugar get into the cells so our body can use it as energy. So with folks that have diabetes, there's a disconnect there happening. So you either, if you have a diagnosis of diabetes, you either aren't making insulin, or for some reason your body can't use the insulin that your pancreas is making. So there's two types of diabetes. There's type 1. Type 1 diabetics are usually diagnosed before the age of 30. In type 1 diabetes, your body is not making insulin. Type 2 diabetes is normally diagnosed after the age of 40. And in type 2 diabetes, your body is making insulin. However, the cells can't use it. So there's definitely a disconnect happening there. We don't know the cause of diabetes. However, you definitely may be more likely to have a diagnosis of diabetes if someone in your family does. So there are links to genetics when it comes to diabetes. So how will you know if you have diabetes? So there's a few telltale signs that we see with patients who are diagnosed with diabetes. So the urge to urinate often, going to the bathroom excessively, that is a sign. Excessive hunger or thirst, that is a sign of diabetes. If you're just drinking and drinking and eating and you're still feeling hungry or thirsty, that's something you're definitely going to want to let your healthcare team know about. Blurry vision is a sign. Sores that won't heal. So if you're developing sores on your body that are worsening and not getting any better, that may be a sign that you're a diabetic. Or if you bump your arm or your leg and your skin is just not healing the way it used to, that could be a sign. So you definitely want to make sure that your doctor knows what's going on. You may be weak and fatigued, even though you're getting a lot of sleep and you feel like you should have a lot of energy. That may be a sign that you could be diabetic. So your doctor may order a few tests. They may check your urine to check to see how much sugar is in, if there's sugar in your urine. They may take your blood. They may administer something called a fasting glucose test. Or an oral glucose tolerance test. And that helps the healthcare team kind of determine if there's that disconnect happening within your body. So there's lots of ways that diabetes can be treated. Diet and lifestyle are huge for diabetics. So lots of times folks really need to revamp what they're eating, what they're drinking, and how active they are. Exercise is absolutely super important for all of us, but especially in diabetics, it's super important to keep that blood flow pumping, keep your energy level up, and things of that nature. Untreated diabetes can lead to serious long-term health issues like kidney damage, even blindness. I've had some patients who have gone blind, after having a diagnosis of diabetes because they weren't managing their symptoms the way that their physician had hoped that they would. And a lot of times that can be hard. Sometimes you need some help managing your disease, especially if you have to take insulin. especially in the elder population, because, you know, folks tend to not be able to see as well. There may be some confusion. So it's very important that if you're taking medication for diabetes or insulin, that you know exactly what you're giving yourself and when, that the dosages are correct, that you're giving it correctly. So make sure that if you have any questions about that, that you reach out to your healthcare team. And I know there's a lot of great home healthcare agencies here that we have in the area that will send a nurse out to you to provide diabetic teaching and education and teach you how to manage your disease, so that you can be feeling your best and making sure that you're doing exactly what your physician wants you to do to manage that disease. Your doc may want you to check your blood sugar at home. So for that, you'll need a glucometer. You'll need the actual machine, which is a glucometer. You'll need the test strips that go with that machine. So be careful if you're, you know, going to Walmart and buying a glucometer. Make sure that you get the strips that coincide with that machine. You will need alcohol wipes to clean your fingers, and you will need lancets. Make sure that you read the instructions with the glucometer, because a lot of times you do have to calibrate it before you use it. And then it'll give you a schedule of when to calibrate and check the accuracy of the machine. So that's very important. So you're going to want to keep a log of your blood sugars for your doctor. So your doc may say, okay, I want you to check your blood sugar before breakfast every Monday, Wednesday, and Friday. He may say, I want you to check it before every meal and at bedtime. So make sure that you keep a logbook of your blood sugars for your physician, so that they can kind of keep an eye on what your sugar levels have been. And even just a simple notebook is perfectly fine for that. If you're getting blood sugars that are excessively low or excessively high, you definitely want to let your doc know. Normal blood sugar is between 80 and 100, even up to 120 after you've eaten. So if you're between 80 and 120, that's a good range to be in. If you're lower than 80 or higher than 120, you know, you're definitely going to want to let your doctor know if that's happening consistently, so that they can maybe tweak your medications or put something else into place for you. So low blood sugar is called hypoglycemia. So some of the things that you might see if your blood sugar is low, and this can be very dangerous because folks can pass out if their blood sugar is low. And I've seen this happen many times with my patients. If you're feeling dizzy, nervous, anxious, weak, shaky, sweaty, if you feel confused or sleepy. So we say look out for the 3 C's: cool, clammy, confused. That can be indications that your blood sugar is low, most likely lower than 70. So what you're going to want to do if you have those types of symptoms is take a half a cup of fruit juice. We use orange juice a lot. Even milk has some sugar in it. A couple crackers. A lot of my patients like the peanut butter crackers. That will help to raise your sugar. A teaspoon or 2 of honey will help to bring your sugar up. So a lot of times when folks are having a hypoglycemic episode, once we get that sugar into their body, they start to come around, they start to feel better, and those symptoms disappear. So that's a telltale, those are telltale signs that your sugar is probably low. So you definitely want to keep a really close eye on that. And if you're diabetic, you always want to have some kind of a snack with you in your bag, in your car, something like that. After 15 minutes of putting some sugar into your body, try to check your sugar again and see where you're at. You may need to put a little bit more sugar in your body at that point. And on the opposite end of the spectrum, hyperglycemia is high blood sugar. So some of the things that you might experience if your sugar is too high is poor vision, slow healing wounds, cuts, sores on the body, skin infection, and nerve damage. I've had patients, that have diabetes who are diagnosed with diabetic neuropathy. And that is when they start to lose the feeling. Most of the time it starts to happen first in the hands and the feet. So numbness, tingling in your extremities. and things of that nature. Early signs of high blood sugar, of course, include increased thirst, headaches, trouble concentrating, blurred vision, frequent urination, weight loss, and of course, feeling weak and tired. So I think it's important that if you're diagnosed with diabetes, you should definitely see a nutritionist. You're going to want to make some changes to your diet for sure. The nutritionist can help you plan meals that are low in fat, but higher in protein, lower in cholesterol. They can help you figure out what your caloric intake for each day should be. You should definitely limit your alcohol intake. Stop smoking. If you are a smoker, please try your best to stop. So besides raising your blood sugar level, smoking also damages your heart and kidneys long term. We know there's lots of terrible side effects about long-term smoking. Definitely exercise regularly. You want to check your sugar before and after you exercise. And again, don't forget to always carry some kind of a carbohydrate snack like crackers, pretzels, to eat if you feel weak. And let's talk a little bit about, so there's a couple types of medications that, there's many types of medications that we use for management of diabetes, but some of those may be familiar to you. So you have metformin, you have glyburide, you have various types of insulin and such. So in the insulin, it helps your body control when your blood sugars are high. The glyburide helps your pancreas make more insulin to lower your blood sugar. The metformin helps lower your blood sugar by making sure your liver doesn't make too much sugar. So each of the medications that your doctor might prescribe has some type of a different goal. So make sure that if your doc puts you on medication, that you educate yourself about what that medication is doing for you in your body, and also what side effects to look out for, just in case, you may experience some side effects of the medication. You'll want to let your doctor know. So how can we prevent health problems? So this is pretty much a general overview of how to keep ourselves as healthy as possible. But for people who are diabetic or pre-diabetic, these things are especially important. Untreated or poorly controlled diabetes will damage your eyes, your nerves, your kidneys, your heart, and amongst other complications. So please take your medicine as prescribed. Again, if you have unpleasant side effects, make sure to let your healthcare provider team know about that. You're going to want to have a complete eye exam once a year. Controlling your blood sugar levels will help you to prevent damage to your eyes. And I've had patients who have lost their vision, and they tell me, like, it is so hard. You've been able to see all your life, and now all of a sudden, gradually, your vision, your ability to see things is decreasing. So that becomes really crippling for people sometimes. Protect your skin. So make sure you're inspecting your skin for dryness, redness, cuts, or any types of skin changes, rashes. Make sure you drink plenty of water. Water is always good for us. Check your feet. So diabetes could damage the nerves in your feet, and you may not even feel it. You may not feel if you get a small cut or a bruise or a laceration. Check your feet every single day. If you feel numbness, tingling, or burning, make sure you contact your doctor right away. Make sure that you're wearing comfortable shoes that fit you properly, and as good as it feels to go barefoot, if you're diabetic, you probably should not do that, because again, if you step on something and get a cut, you may not even realize it if you've got that numbness and tingling going on. Keep an eye on your blood pressure and weight. Your doctor can always check at your regular appointments. You can get a cuff a lot of times through your insurance company that will measure your blood pressure at home. And your nurse will show you how to work that at home. Blood pressure, 130/80 or less is really best. Watch your blood cholesterol level. Definitely have it checked once a year. Your total cholesterol should be below 200. And also just find support. If you're diagnosed with diabetes, there are diabetes support groups. I know, especially here in Lake County, I'm not sure about other areas, but I know they exist. So you could reach out to your local health department to see if there's some support groups around. Sometimes it really helps to talk to other people who are going through the same things you are. So that's kind of a general overview of diabetes. Some of the symptoms to look out for, some of the ways that we can prevent the disease. It's all about, being healthy as best you can, exercising as much as you can, watching what you're putting into your body, eliminating smoking and excessive alcohol intake, those types of things. So I hope that I taught you a little something today. Again, please feel free to reach out to me if you have any questions. And again, if you feel like you're experiencing any of these side effects, don't hesitate to reach out to your healthcare provider. They will be happy to help you. The more, knowledge is power. So the more we know about what's going on with our bodies, the better that we will feel long-term for sure. So thank you again so much for tuning in to Shannon Sunshine Share. Please feel free to reach out to me if you have any health topics you'd like to chat about. And I will see you next week. Have a great day.